And welcome back to Moving Conversations. I'm Brian Ritchie. Joining me as always is Nora St. John. How are you doing today, Nora?
Just peachy, Brian. I've been on vacation for the last like 3 weeks because of the worldwide IT meltdown. I got stuck in DC at my brother's house, which wasn't bad. And now I'm home, so I'm very happy to be home. It's hot as heck here in California, but so it goes. How about you?
Doing good, doing good. I'm going to let everybody in on the behind the scenes. So we record these because of my travel schedule and Nora's travel schedule. We record these in advance, and we had gotten well in advance. So this is the first time that I've laid eyes on Nora since June.
May, June? I think
June,
June. I'm
early
thinking
June,
June.
mid-June,
Yeah.
something like that. We recorded
Yep.
our last one. So it's been a long time. She's been on the road. I've been on the road. I just got back from Idea World, the big fitness convention. You were in Europe teaching the advanced movement principles, as well as taking a vacation, much needed, might I add. I got to do that one day. One of these days, I got to do something like that. You know,
Well,
that
it
would
had
be
been
good.
about 10 years for me, so it's good. I recommend it. Every 10 years, you should just like stop working for a couple of weeks. It's a great idea. All you guys should do that.
Yeah, exactly. And anybody in the fitness world, you don't
Yeah.
work, you don't get paid. So
Yep.
everything's pretty much nonstop. And people always joke, or clients are always like, oh, you're going to so and so. And it's like 9 times out of 10, I see the airport, the hotel. I see a
The
little bit of
conference
the
room.
area when I'm driving to the hotel, the conference room, back to the hotel and back to the airport. So
Uh-huh.
we don't often get to see a lot of the place, but we get to see bits and pieces. But I am taking more advantage of it as I travel nowadays. I'm getting a little older. It's like, look, I don't know when I'm going to be back here. So I'm trying to take advantage of it. And I highly,
Totally.
highly recommend it to everybody that if you are in some place for a conference, or if you come and see us talk somewhere or something, get out, see the sights, enjoy, because trust me, it's worthwhile. And
It always
you only go
is.
around
It
this one
always
time.
is. Absolutely. Take advantage. Have
Exactly.
experiences. That's what you're going to remember in your life, right? That's what you're
Yep.
going to remember as experiences
Exactly.
and being places and meeting people and having a cool time.
Exactly. Exactly. Well, today we are going to do sort of like a part two on a
Mhm.
topic that you and I have been teaching a lot over the last few weeks on the road.
Mhm.
We've been talking about the knee. We did ACL. And today we're going to talk about more of a knee stabilizing, knee stability in general. Because I was teaching the anatomy in 3D, common conditions of the knee. You've been teaching, about the lower body as well as the upper body with the advanced movement principles. So it's sort of been on our plate a lot. So it's something that's definitely fresh in our mind. So I thought, why don't we talk about that a little bit today? But before we do, I want to remind everybody, please do me a favor, hit the like, hit the subscribe, hit the thumbs up, whatever, your thing is for whatever your platform is, hit the button that says you like us. We'd appreciate it. And not only that, do us a favor, leave us a comment. With the more comments we get, the higher up it gets in the algorithm. It gets pushed to other people, your friends, people who you might think, hey, these are cool people. You might want to listen to this as well. Also, check out the YouTube channel. You can uh, get us there. It's under my name, Brian Ritchie. And
Great.
all of that's also in the course description. So you can just click on that and get to that. And that way you can see us live. So when I'm holding up a model of the knee right now that you can see, you can actually see what we're pointing to. So yeah.
And if English isn't your first language, YouTube, you can also do closed captions, whatever your language is. And Brian and I both do a lot of work around the
Yeah.
world. So that's another thing about the YouTube channel is you can do it in Spanish, you can do it in Korean, whatever your language is, you can actually listen to us relatively accurately,
Yep.
depending.
You know what?
So
I actually get the
manage.
breakdown of where people are listening from, and you'd be surprised at how many people are international. We have a
Yeah.
lot in Asia because you and I are fairly popular in
Yeah.
Korea and whatnot, but we're getting a lot from various places in Europe and Spain and France. And it's really kind of neat that people can get to us on YouTube and see the closed captioning and follow along and really know what we're talking about. So it's not just, listening to people yammer on in a language you don't understand. So, yeah.
Exactly. Exactly.
And if you want to get in touch with us directly, we answer all emails. You can hit us up at movingconvos@gmail.com. That's the easiest way to get in touch with us. But If you hit us with a DM through any of our Instagram at Moving Combos or Moving Conversations on Facebook, we will respond. All right. So enough of that. Let's jump in to the knee. We're going to talk all about the knee and knee stability. You ready?
I'm ready.
All right,
So
let's hit it.
what I'm going to start with is just this idea, which you and I both talked about many times. The knee is in many ways the slave of the hip and the foot.
Yes.
So when we talk about knee stability, we can think locally, but we've got to look globally. We've got to look up the chain. We've got to look down the chain because a weak hip will decrease knee stability. Ankle instability will decrease knee stability. So you've
Yes.
always got to look, it's just like, yes, we'll focus on the knee and what we need to do to get that nice and strong and stable. But you've always got to look up and down that chain or else you're not going to get the results you want.
And what's interesting is you have these two philosophies in fitness, whether it be Pilates or in general fitness. Some people only do the foot. That's where they always start. They start at the foot.
Yeah. Yeah.
And I've had people argue with me because I may start at the hip and they get mad that I'm
Yeah.
not doing it their way. I was actually in Korea and this woman was arguing with me that I wasn't working with the foot first. And I said, hey, you can hit it from both or either, but you need both. You need to have a stable foot. You need to have a stable ankle and you need to have a stable hip and a strong, well working those areas and mobile in order to have good knee stability.
Yeah, I was just teaching the advancement principles educator training in Spain on the lower body. And I started out with, here's a little bit about the lower body, but then we went to the foot and we went to the hip. We did those first. Right.
Yes.
So looking at gait, looking at how the foot works, looking at foot mechanics, like the ankle, and then going up and looking at the hip and looking at how pelvic misalignments create imbalances in the myofascial system and in the muscular system. And then that decreases knee stability or knee balance. And so it was really interesting to start foot and then go hip and really see how the knee is in between those 2 points and
Yep.
can often be considered, the victim of those two situations if they aren't working well.
Absolutely. I remember way back when in Hawaii, I used to work with a lot of people who would do the marathon.
Yeah.
And almost every single person who had never run before but decides to do the Honolulu Marathon because it's one of the big ones in the world, like the Boston Marathon, they want to do it, but they don't know how to train properly for it. But they'll look online. But back then you have a book and you look at the book and the book says to do it this certain way. But almost all of them would come. Eventually I'd see a lot of these people and they'd say, I have knee pain. I have a lot of knee pain.
Yeah, absolutely.
And almost to a person, it would either be the hip or the foot.
Mm-hmm.
I'd say the hip probably 2/3, the foot 1/3 based on the people I was seeing. And it was probably a combination. So I worked with both of those. And a lot of times without even touching the knee, they would start getting stronger. They would start getting better. And they say, my knee's not hurting, but we're really not doing a lot of knee work. And I said, you're right. Because your weakness wasn't in the knee joint, but it was the surrounding tissues.
Exactly. And that's where people often get like, well, why is my knee bothering me? And then they want to focus on the knee and they're like, why aren't we focusing on the knee? You're like, because that's not what we're doing here.
Exactly.
That's that we can do that. We'll get to the knee, but we're going to get to it through these two other places.
Yep. So which would you rather start with just in brief? I want to start with the hip. I'm going to tell you that right now. Okay.
Let's start with the hip.
I decided to jump in for that. One of the things that I've been telling people for years, in my mind, the gluteus medius is one of the primary stabilizers of the knee.
Yep.
And when I tell people that, they all say, well, but it's not connected. How is it? And I said, no, if that's not strong, your knee, your femur will internally rotate. You're going to put too much pressure on the medial aspect of the knee. You're going to have nothing but knee issues. It is a primary stabilizer of that knee. And again, I get into arguments with people, but again, as soon as I start working with them on their hip, strengthening the gluteus medius, my gosh, their knee pain starts to diminish quite a bit and quite quickly.
Yeah. It's one of those things where when I'm watching somebody move and I'm kind of trying to see what they're doing, one test, and this is from Pilates repertoire, but you can use it too. One of the things that lets me know that they're not that strong in their lateral hip is if, let's say, somebody is stepping up on a step or stepping up in Pilates on the chair, and they put their foot either up on the pedal or on the seat or on a box, like a high box, not quite a plyo box, but like a box, and they step up onto it and their knee goes medially.
Hmm.
Right? Like, that usually tells me that there's not enough hip stability laterally to be able to have that knee track straight and maintain the balance around that knee when they're loading it, when they're loading it upstairs or loading it downstairs or they're, stepping up a curb. That's when I know that there's some weakness in that lateral hip. I mean, that's one sign that I use.
Absolutely. Something that I've used is a side step up, even just a 4-inch step where you put their foot on there. And when you put their foot up there, or even a 3-inch step, their heel can usually stay down. Where does their knee naturally want to go? Does it internally rotate? Does it track medially before they've even loaded it?
Yep.
And when you see that, you're like, okay, all right, something's going on here. I've been dealing with this with one of my sons. We've been working out in the gym, and I've been noticing that his knees, and I find this when I work with a lot of young preteens,
Mm,
you know, 10, 11,
yeah.
12, 13,
Yeah.
where they don't have a lot of hip strength, quad strength, hamstring strength. They just have general run around the playground strength. But
Yes.
for fitness, for doing things in around the gym, even a proper squat, their knees are all over the place. They're not tracking right. And almost always his knees want to come in. His knees
Yep.
want to come in.
Yep.
So it's like, okay, guess what we're working on, gang? We're working on those hips. We're working on those glute medius. And I'm now noticing he's able to track a lot better. And it's just
Yeah.
something that I notice. And I'm like, oh, okay. I can see that in someone that young. And we see it throughout people's lives.
Yes, absolutely. Absolutely. I mean, that's one of my typical like go-tos. If there's a knee problem, work on the lateral hip. I just always go
Absolutely.
there and like that, like, when you're going more locally and you're talking about the vastus medialis, vastus lateralis balance, that's a little more local, but I often start, up at the hip and like you, if I can get that stronger, two things actually. Yes, it definitely gets a better balance around the knee, but the other thing too is if you're doing something like sidestepping,
Hmm.
right, with or without a band around the knees, for example. That's sort of a classic just step side with
Hmm.
maybe some resistance around the ankles or whatever, or around the thighs. That also is creating functional stability of the knee to be able to tolerate movements that aren't just sagittal,
Hmm.
right? Which is also really important because a lot of times knee instability shows up not when you're just walking or running or doing something very sagittal where your body's used to that movement pattern, but when something unexpected happens or you have to step over something or you have to step sideways. And that's when you'll often make the knee vulnerable because there isn't the
Hmm.
strength to take that lateral motion.
Yes. Yes. And we see that in people who do get injured. And I'm going to make a generalized, group here and say we see a lot of ACL issues with female soccer players,
Yes. And
a lot of
basketball players.
basketball,
Yeah.
volleyball,
Yep. Yep.
those that are moving side to side a lot, but may not have that lateral stability in their
Hmm.
hips. Now women are built much differently than men. They have a larger Q angle in the hips in general, not all women, but
Yes.
in general, they have a larger Q angle. So when they have that on top of, so they have a structural difference
Yep.
and a muscular weakness or not as much integrity in lateral movement
Yep.
as they have been trained to do that. And you throw them into, oh, here, go play this sport. It makes their knees vulnerable. It makes their lower body in general vulnerable.
And I think the other thing too, particularly with women athletes, is there's also more likelihood for mobility, for hypermobility, or more
Oh, yeah.
mobility than is
Good point.
desirable in the joints. That the ligaments just not always, but tend to be a little bit looser, a little bit
Mhm.
longer, and just some debate about this, but there's discussion in the literature about how the ligaments are subjected to the hormonal cycles of women. So relaxin is what is needed at the end of pregnancy to essentially soften the ligaments so the pelvis can move so the baby's head can come out. But there is a small relaxin release every monthly cycle. And that also can help to change, I would just say, not necessarily loosen or tighten, but change the tension on the ligaments, which confuses the body a bit and creates some instability from that, right? It's like the body's used to
Mhm.
being here, being this tension, and then suddenly it's a little looser, and that confuses the whole proprioceptive system in the body, makes it less accurate.
That makes a lot of sense. That makes a lot of sense. And if you think about it, it'll change the integrity in general.
Yeah.
It will change that. And like I say, we see this. And I've worked with a number of young women who have come to me in their 20s and 30s. And if they've ever played sports, almost all of them have had a knee injury of some kind or a knee surgery.
Yep.
And a lot of that can come from this. And I've read some literature that's actually said you want to prevent ACL tears. You need to work their lateral hip.
Yep.
And now look, we all know you cannot prevent all knee injuries. There's no
No,
way.
something's gonna happen. I mean, your
Some
foot's gonna get
things
stuck,
happen.
you're running
Bingo.
fast, and your foot sticks, and you rotate, and
You rotate.
trouble, right? Trouble.
Exactly.
Yeah.
But much like for balance, if you have strength, the chances of you recovering safely from a
Yeah.
position where you are rotated or you're falling or you're moving in a way that maybe the knee wasn't designed to do or doesn't move well in that direction, to be able to come back from that when you're strong in your lateral hip and the muscles connected to it, you have a much greater chance of not getting injured in those situations. You just have a greater chance of not. Not that it's not going to happen. It can, but that recovery period, much like with balance, someone who's stronger, who has a quick step, as they feel like they're off balance, their body can recover quickly. Same thing.
Well, the other way to think about stability is, because oftentimes we think about stability as being staying in one position,
Oh, yeah.
right? And when you think about knee stability, if you ever watch, and this was really just a wonderful revelation for me, if you ever look at basic sports photography, right? Just like look at the sporting page, any action shots that people are in, or go to the web and look at like action shots of football or soccer or tennis, and you see the position of the knee. Like it
Mm,
is not straight in line right over that toe. Most of the time, it's doing something funky. It's over to the side. It's medially rotated. It's something's going on, because that's the nature of fast moving reactive movement. Is that knee could end up in a lot of places. So a lot of times when we talk about knee stability, and you just mentioned it here, but I just want to bring it up a little bit more, is that ability of it to go out of position and back
mhm.
into position without causing damage. And
Right.
that's where the strength comes in, right? If you've got
Yep.
the strength and you've got the resilience and you've got the mobility, that's when you can take that sudden lunge to the right with your knee way over your toe because you're trying to hit a ball and come back from it. Your knee's like, yeah, no problem, I got this, right? Because there's
Yep.
strength around it.
Yep. Absolutely. Absolutely. And any way you decide to train the lateral hip, whether it be open
Yep.
chain with the things like I have the 7-way hip or sideline leg raises or clamshells or any of those type of things are great to start with. But if we have athletes, we want to get them into closed chain. We want to get them into moving sideways, where walking sideways with the band around your knees, either squatted or straight up, but also doing things like grapevines,
Yep.
cariokas, doing some shuttle work, going back and forth sideways. I have people skip sideways, where
Uh-huh.
they're actually
Yeah.
leaping a little bit. So they
Yep.
have to land and catch themselves and then leap again and land and catch themselves over and over again. And
Yep.
we're talking about 60 and 70-year-olds doing that
Yep.
because their knees need it too. We can't treat them like fragile, Fabergé eggs. We need to realize that they need to step over things. They need to step up onto a curb. They need to, manage life out there.
And maintain their agility. Right,
Yes.
because if they don't respond quickly, if they respond slowly to a sudden, change in surface or snow or tripping over something, that can lead to a fall, that can lead to a break. Like that's just not a good thing.
Yep.
So, yeah, no, my older clients, like I always have them do sidestepping and I have them do variations on grapevine. And grapevine can be hard when they start.
Oh,
They get really tripped up, and I just have to take a moment and like, okay, we're just going to go step, front, step, back, change direction, step, front, step, back. Take it really slow, and then we slowly build it up till they've got some more comfort with it.
I had a client do it for the first time uh, on Monday morning, 2 days ago. And I just we were out in the hallway and I said, here, I want you to do this. And it didn't dawn on me that I hadn't done it before with this one client. And she looked at me and I, went into it real quick. And I said, I want you to do this. And she's my age. She's not that old. She's in her mid-50s. And the look on her face was like, hang on, hang on. It's like I gave her this very extensive choreography.
Yeah.
And she stepped over her one foot and she stepped back. And as she stepped behind, she goes, wow, this is harder than I thought.
Yes.
And I thought, oh, yeah. We take it for granted because I've been teaching group exercise
we've been
classes
working
for
on that
so many
forever.
years.
Right.
Yeah.
And it's been just part of our movement repertoire because we know it's important. I mean, forever.
Right. Exactly. And in sports, something that people don't realize, if you ever go to a baseball game early and watch batting practice, you'll see the outfielders doing grapevines in the outfield.
Yes.
All the way from one side of the
from
field
one wall to the
all
other.
the way to the other. And they have to, because they have a lot of ground to cover. If you've ever been to a Major League Baseball field, you can see one guy standing in this giant area that they have to cover for a pop flyer to catch a ball.
Yeah.
They've got to be able to move forward, back, side, all of these different directions, and to be able to do so quickly. And while they're athletic, they still need to warm this area up. They still need to get it moving. They still need to remind the muscles, oh, here's what we need you to do.
Absolutely.
So it is important. It's a great exercise. It's a great exercise to do. So working that lateral hip, so important in so many different ways that you can do it. I mean, in the Pilates repertoire, I love using the reformer or the Coraline, for pushing out, while standing on either the carriage or on the carts on the Coraline.
Or on the floor. Yeah, exactly. All the ways to just kind of make that even easier. One of the thing I like to say with the lateral hip is this is just from doing Pilates for a really long time, right? One of the key things in Pilates is all the side lying open chain leg work, right? With the top leg, just leg lifts and kicks front and back and circles and all those kind of things. And I was working with a client and they'd been doing those for quite some time. And I really hadn't seen a change in terms of their actual functional standing stability. So I said, okay, let's work on this closed chain. And it made a huge difference. So I'm okay with like clamshells and all that stuff, but I always want to make sure I am doing some work closed chain because I really feel like that translates better to the functional kind of stability that I want from the hip and the knee. Yeah. And so just, don't forget closed chain on that. It's really important. And that can be as simple as standing on one leg and moving the other leg and like forward and back, side to side, making little circles with the other leg. So that one's being open chain, but it's the closed chain leg that's working, right? To manage all the different angles of that other leg. That's
and how many times have you,
or whatever.
Yeah. How many times have you had someone do that? Stand on that one leg and you're doing a side and you're kicking out to the side and you're kicking back and you're kicking forward. And they say, well, the leg that's moving, that's easy. But the other one is burning like crazy.
Exactly.
I said, exactly. That's the one we're working. That other leg is just moving your center of gravity around a little bit is all I'm trying to do.
Yep.
It's that standing leg that we're really focusing on. And that's something you can give all your clients. You can give anybody. You can give your mom to do while holding onto the kitchen counter.
Exactly. Just swing that leg front and back, inside and outside, make little circles with it. Yeah. And form is, isn't that important there. So it's like if they're doing it funky, it doesn't really matter that much. They are, because what you're also trying to do there is create stability of the lateral hip, whether the hip is flexed, whether it's neutral, or whether it's extended. Because if you just think about walking or running, that hip needs to have stability in all of those positions, right? As that leg swings from the back through stance to the front, like you've got to have stability and support to that lateral hip through all that motion. So, so whatever they're doing is going to be helpful there.
Another thing that I want to throw out there that I use for any client over the age of 45, 50 is stepping not only sideways, but up and over an object.
Yep. I do that all the time.
I was in a class out at World. I decided to sit in on a colleague's class and he says it's called stepping over the dog. And I said, brilliant.
Yeah, exactly.
Brilliant. Because I do that all the time. I've got a big golden retriever and where does he want to be? Right under my feet while I'm cooking dinner. And so you have to be able to step at weird angles. It's not exactly perfectly sideways. It's sometimes at a weird angle. And when he said that, I said, I love that. I'm stealing that. That is such a good good description. But when I have
Exactly.
clients do that, you'd be surprised at the fear. And what I do is I take a band, you know, those flat bands,
Yeah.
and I put it on the ground and I fold it in half. So how thick is that? We're
Yeah,
talking
nothing.
about
It's
less
nothing.
than half a millimeter.
Exactly, nothing.
And I say, I want you to step over that. And they look down at it like I'm asking them to do a 2-foot hurdle.
Right, right. Yes.
And then I'll put a tube, and a tube is maybe half an inch.
Yeah.
And the same thing, they get very jittery lifting their foot up and over. If they go sideways, they like to shuffle,
Yep,
slide it.
exactly.
But by lifting up and over, as I lift that leg, I have to balance on one side. Now I'm
Yep,
propelling myself using that standing leg. I'm stepping out to the side. Then I have to land using the leg that I'm landing on. That hip is catching me. We're talking about a ton of hip work
yep,
that's almost incidental for young people, but for
yes.
older people over 40, over 50, it can really be a game changer in the way that they move,
Yeah, absolutely, absolutely. Yeah, and
you
I
know?
do I do so taking that up a step, like, I'll have them on, a moon box, a Pilates moon
Mm,
box. I'll have them, so the moon box is facing short side is facing to them or whatever, the side, and they step up on one foot, and then they step the other foot onto it, and they step that foot down. So they're gonna go up,
yep,
up, down, down, up, down, up, and down, sideways. And then I'll have them kind of start to actually take it quicker. So they're kind of like almost just barely touching it, like touching down in the top and just going back and forth, just to
yep.
keep start to get the agility going too. Because I love the dog idea. I call it stepping over the dog as well. Or depending on the age of your children, stepping over the Legos on the floor because there's always something on the floor that
Yep.
is going to hurt if you step on it and you suddenly see it and got to like, right. Or if you've got a small dog, it's almost worse because at least big
Oh,
dogs kind of don't get you. Little dogs just like run right under your feet. You don't want to kick them. So there you go.
yeah, exactly. Exactly. No, I do a similar thing with I call them side step up and over
Yeah.
because I have a regular Reebok step. Okay,
Yep.
one of the old
Yep.
fashioned ones. I've
Yep.
had it for at least the last 20 years.
Yep.
And what I do is I'll say, okay, now put your feet up next to it
Mhm.
sideways. You're facing
Yep.
sideways. Step up on top of it. What do they naturally want to do? They take the foot closest,
Yep.
barely step on top of it. And then when they step up, there's no room for their other foot.
Right.
So now I say you have to take a bigger step. Oh, okay. They take a
Exactly.
bigger step and they come up. Then when they put a foot down, it's right next to it. I said, where are you going to put your other foot? And they're like,
Yep.
oh. So now they have to step a lot farther with
Yep.
each step up and over. So they're not staying so close. And it's taking them a little out of their comfort zone of widening their stride a little bit
Nice.
laterally,
Nice. Yep.
which again is just something that they don't do on a regular basis,
Yeah.
but they
Absolutely.
need to have it in their repertoire because you're going to need it down the road. You're going to need to use it.
Well, you just don't know when something's gonna to require you to step sideways. Life is not perfectly sagittal at all.
Right.
So that was great. There's a lot of things in there,
Yeah. A
guys. I
lot of
think
stuff in
there's
there.
a whole lot of practical bits in terms of working that lateral hip, which again is critical for this. Let's take it a little bit down to the foot and the ankle.
Okay.
Just to shake it up a little bit. Um, One of the other things too that I see a lot and I work on a lot is that ankle stability, medial and lateral. Because again,
Yep.
most people are decently strong in dorsiflexion and plantar flexion, the sagittal chain on their ankle, but oftentimes, I mean, I've had clients who literally can't move their ankles into kind of eversion and inversion or pronation, supination. Depending you talk about that, like they literally have no mobility in one range, and
Yep.
it's not that they don't have the mobility; it's that they don't know how to use it. Like I can move their foot there, but they can't move their foot there with their muscles because they just don't know how
Yep.
to do it. Working on and super simple. A lot of times I'll have people do this either even seated in a chair or seated off on a trap table. So it's kind of higher and their feet are free, just
Hmm.
pointing and flexing, and then pulling the toes back and then rolling the feet in and out. So
Hmm.
dorsiflexion and a little bit of in and out, or plantar flexion, a little bit in and out. No resistance. They don't need a band. They don't need anything. They just need to work some of those ranges of motion that they're not familiar with. And that's another really nice way to get some medial and lateral stability at
Yep.
the ankle so that ankle can then take some of that unexpected step or stress or surface, and that force will not necessarily immediately transfer up to the knee because the ankle kind of gives way. Yeah.
Yep. Yep. I We talked about this when we talked about the ankles, sprained ankles and whatnot. I love alphabets where you're just using your
Yep.
ankle and drawing the alphabet. Also, to go back with what you were just saying, for just sitting, I'll have people sit at their desk and
Yes,
literally take their
exactly.
foot flat and then tap in and
Yep.
out, like they're going up and over something
Yep.
because it's getting the whole ankle, it's getting that medial, that lateral, it's getting dorsiflexion, which is what we tend to lose. Most people are much stronger in plantar flexion, but
Yep.
it's getting all of that in one fell swoop. And I'll say do 20 repetitions and then go back to your work.
Yep.
Not hard to do. You can do it every day, but as they get better at it, they're like, oh yeah, it used to burn. Now I don't even feel anything. Like,
Yep.
aha. So you've got some
Exactly.
better stability. And that's easy to
Exactly.
do seated.
Yep. The other thing too is, and I always, I always take a look at all my clients who are having the issues is what's happening with their shoes.
Mm,
And one of the key things that I work on with all my clients, and certainly when I worked with the podiatrist at the Center for Sports Medicine, the first thing they would do with someone with new issues was ask them about their shoes. And the two things they'd ask them are, have you recently changed your shoes?
yep.
So in other words, changed your brand or whatever, or have you not changed your shoes in the last 6 months?
Yep.
Right. So if I've got a person who suddenly comes with the knee pain and they really haven't had it before and their mechanics are generally pretty good, and I'm like, what's happening? And I say, well, what's happening with your shoes? They say, oh, well, this is my favorite pair. I've been wearing this for the last year and a half. How much do you run? Oh, I
Or
run,
10 years.
yeah, exactly. It's like, well, I run, 10, 15 miles a week. And I'm like, okay, you need new shoes. Like first thing is get new shoes.
Yep.
Because a lot of times that's the issue. It's just the shoes break down and it's pushing the foot into a position that is then causing some knee pain. So sometimes that's a simple solution for a lot of my knee pain people, at least to start with. Then, of course, I want strengthening, other kinds of things, but sometimes I'll always ask about their footwear because that's the problem a lot of the time.
It's not only their footwear, I find clients who maybe, like you said, we all have our favorite pair of shoes, super comfortable. They don't want to buy a new pair because number one, I don't know if you've bought sneakers lately, but what
They're
used to be
crazy expensive.
$75 are like 150 to
They're all they're
175.
they're all over $100. Yeah.
And I go through them because that's what I wear all the time.
Yeah.
I usually replace them every 3 to 4 months. And that's a lot of money to be spending. And when I talk to a client, I say, look, you've been wearing them in here with me 2, 3 times a week for the last 6 months. I don't know what you do outside of here, but I'm assuming you're wearing it there too. It's time to replace them. Okay. Number two is I can't tell you how many times people will buy new shoes and I'll say, well, you had orthotics in your shoes. Are you wearing them in this one? Oh, I forgot to put
Oh,
those in.
that's right, that's right. Yep,
And they
yep.
go, I forgot. Or they had this cheap over the counter ones, and I'm not saying that they're bad, super feet,
Yeah, yeah.
there's so many different types, but they say, oh yeah, I had those inserts in there. I totally forgot that those were the inserts that were in there. I said, well, if you haven't thrown them away, you're using them as yard shoes, maybe pull them out, replace the, and just see if that helps too. Because sometimes doing something as simple as that is like, oh yeah, now they feel a lot more comfortable and I feel like I can move, again in the shoe, and I have the support it needs.
One other suggestion, at least for serious runners that I've worked with, and this again came from our podiatrist, was now, in case any of you haven't bought tennis shoes recently, you know that if you find a pair you really like and you go back to the store to buy another pair 3, 4 months later, they don't exist anymore.
Yep.
Right? So there's
They
that,
change
there's
the
also
last every
that.
time.
They change every time, and you're like, "Really? I like this one. This one works for me." So the other thing too is, and what our podiatrist would say was buy 3 pairs. Buy
At
3
least.
pairs. If you've got something and if you do it and you try it, go back quickly, buy 2 more pairs, and then alternate them. So we're 1 for a week, 1 for a week, 1 for a week, and then go back and recycle through them, especially if you run a lot or are very active that way, because that means that the breakdown is going to be much more gradual on the
Hmm.
shoes. Yeah, so those are crazy tricks, but they can be pretty darn helpful, especially for your serious runners or my people who
Yep.
suddenly decide they're going to do team and training, or they're going to do a marathon, or they're going to do something where they really are suddenly increasing their mileage a lot. They
Yep.
really need to think about that as they go. So things,
Yeah.
little tips and pointers there.
Absolutely. No, those are great. Those are great. I've d- I've done that in the past where I will have two pair and I'll exchange every other day. And what I found is instead of needing to replace it after 3 or 4 months, I'll get a year out of two.
Right.
So
Exactly.
I'll get 6 months out of it instead of 3 to 4.
Yep.
So you're wearing one for a day, but then that springiness and everything can recover a little bit more
Yep.
over the next day rather than I'm putting them right back on. And at 190 pounds, I'm on my feet all day. That's going to be quite a bit of breakdown, even if I'm not running, but I do
Yep.
cardio and I'm doing this and I'm working out. There's a lot more breakdown.
Yeah. And you're
So,
standing. Yeah. Yeah.
yeah.
So those are some things. Now that still is, we talked a little bit about the feet, but just spent a few days with a foot expert, my friend Nancy Myers. So I'm kind of all into feet at the moment. But the other thing too is really to work on particularly ankle strengthening and foot strengthening as well. If there's really a knee problem, much like the hip, I've had more than one client where I really work on, for example, dorsiflexion, and really get dorsiflexion stronger, and that solves a lot of knee problems. One of the orthopedic surgeons I worked with, that was one of his go-tos for any kind of knee issue. Was, yeah, he'd work on the vastus medialis, the vastus lateralis, the lateral hip. He'd also work on dorsiflexion strength. And he found that that really made a big difference in terms of knee stability and knee support for kind of functional activities. And I thought that was just that's a tip that I've used and had some really, really good results with as well. It's just,
Yep.
and that one, like I just toe tap. I'm like, okay, try on your favorite song and just tap your foot. That's a great way to get the little dorsiflexors active. It's super easy,
Yep.
and you'll get a burn and then, then you're done.
Yep. Yep. Absolutely. Something that I use for when I'm trying to strengthen the entire foot. I love balance work
Yep. Yep.
because I'm going to get both the hip and the foot at the same
Yep.
time
And the knee,
and the
right?
knee
You're going to get the
100%.
whole system.
You're going to get the whole system, whether I use a wobble board or a balance, pad, one of the squishy
Yep.
balance pads, or even I tell people just get a pillow that you don't like, put it on the ground. Don't take your wife's favorite pillow. I got to tell my guys this because they will grab the first one that they see. I'm like, no, no, no. Grab one you don't like, or grab the dog's pillow. Use
Right,
it.
or the guest bed one, which you
Yes,
don't use
Bell.
very often, right?
Exactly. And stand on that. And what you're going to feel is you're going to see and feel that your foot is you're going to feel it in your ankle. You're going to feel that moving. You're going to feel your hip. You're going to feel the knee. And the thing that I like about, and I tell this to my client, is you're going to feel that knee do this just a little bit of movement, not a lot, but a little bit. And they're going, oh, yeah, I can feel that. And on top of that, like you said earlier, kicking out to the side or forward and back, or lifting up one arm.
Yeah.
And
Yep.
going back to our thing with
Looking to
Erica, I
one
was doing
side or
this.
the other, right?
Yeah.
Yeah.
Client I had this morning, older gentleman, I wanted to get him neurologically involved too. So I had him
Mhm.
standing on one foot and I said, okay, right hand forward, left hand behind you, left hand to the side. I was making him respond to what I was doing. So he didn't know. So he was working that leg, he was working the ankle, the knee, the hip, but he's also using his brain. And afterwards, he was exhausted. We only did that for about 2 minutes. And he's like, wow, that was tough. I was like, yeah, good. So I got everything involved.
Yeah.
But again,
Absolutely.
working that whole lower body, and it was all about stability. And the thing I've
Yeah.
been playing with the most with that exercise also is pitching forward from the hip and back.
Uh-huh. Yep. Yep. Yep.
A
Exactly.
little bit of a hinge hip, not much, 20 degrees, just a little bit forward and a little bit back. That dunking bird, you don't have to go very far. But as you do that, what happens is you light up all those ankle stabilizers because as you go forward, everything's like, oh my gosh, what's going on here? And then you lift an arm or you try and turn the body a little bit. And now everything is working. It's great.
You also get with that different angles, like we talked about the hip, right? As soon as you tip
Yeah.
forward, you're using different stabilizers in really the whole leg, right? At
Yep.
least different angles of the glute med and that kind of thing. So you're really getting some different pieces that are part of that stability system.
Yep.
Nice. So unstable surfaces of whatever kind, and you can start super simple with that, right?
Yep.
I mean, that can ramp up as far as you want to go, but just a little bit of a balance pad, something really flat and kind of just slightly squishy, some slightly unstable. All those things are great places to start.
Now, one thing I'm going to make mention is we talked about the muscular system. We talked about
Yeah.
the muscles that add for stability. The thing
Yes.
we haven't really mentioned is the ligament structures. And there's something that we can't, it's not like I could say, oh, make your ligaments stronger. I'm
Yeah.
not going to be telling
Yeah.
you to go and eat this or drink that. No, 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 no. I'm not talking that. But we have to remind ourselves that if you have a client with a knee issue, they're probably going to feel much stronger or more stable in a straight-legged position,
Right.
because that's when our ligaments are taut. As soon as we bend our knee, a lot of those ligament structures go a little bit slack, especially the collateral ligaments on the outside. And even as we bend it, part of the ACL, becomes, the anterior portion becomes a little more slack. The posterior begins to stretch a little bit more. So it's just something to think about, that if you do it with a straight leg, a balance activity, you're probably going to be in a position where they're not going to have much discomfort. Whereas if you put them in a
Mm,
partial squat position for balance,
much
you're
harder
probably
on them.
going to be much more difficult and require more muscular strength of the quad and all of that as well. So that's a little bit
Also,
more advanced.
yeah, you're also going to load the knee more. Just as soon as you bend
Exactly.
the knee, the load goes way up on the knee generally
Yep.
too. Yeah.
Exactly. So if you have patellofemoral syndrome, that can definitely get active with that. So I usually mention to people, try and keep the knee straight, even on something like an open chain straight leg raise, because as soon as you bend that knee, suddenly that knee is no longer necessarily stable or as stable. So I try and make sure people lock that knee out or straighten it as much as they can when they're doing that, because it creates a greater stability at that end, so they can focus more on the quadriceps as they're lifting the leg rather than just the hip flexor.
Nice. Nice. And again, that's progressive, right? So
Yeah.
if you start with that, you start with straight leg, you start with maybe they're holding on to something when they first do that, and then they take a hand away, and then you add the leg movement or the upper body movement or even the head moving right and left. All those are balance challenges. And then you
Yep.
maybe increase the instability of the surface they're on. Like there's sort of an infinite progression from of balance work, from just standing on a flat surface, which for a lot of people is enough of a challenge,
Yep.
to standing on, a tiny bit of instability, more and more up to wobble boards and
Yep.
crazy things like that. And you just, you grade it where the client can tolerate it. Balance is a learned skill. Balance
Mhm.
is it includes our proprioceptive system, our vestibular system, so our inner ears, and our visual system, and all of those need to work together to create balance. And
Mhm.
there is a myofascial component, but a lot of it is the neurological integration, and that's why you can learn and be better at balance fairly quickly, because a lot of it is
Mhm.
neurological integration more than myofascial strength. I mean, there is that too, but really a lot of it is just the neurological patterning working better to coordinate all the bits.
Yeah, I was actually talking that specifically with a client this morning. I have a new piece of equipment, which is a platform that's sprung. There's four springs that hang
Ah,
down,
yeah.
and you
Hmm.
step up on it, and it moves a little bit front to back, left and right. And it's
Yeah.
great for balance. It's great for stability and all of that. But one leg was going crazy on him when he first did it. And I
Yeah.
said, this is
Kind of doing
neurologic.
the shaky
Oh,
thing.
yeah.
Yeah,
And,
yeah,
it
yeah.
would go to one side, his body would overcorrect, overcorrect,
Yeah. Yep,
overcorrect,
yep,
and
yep.
back and forth. And I said, quiet your brain. I gave him things to hold on to. And by the third set, he said, I can do this. And I
Yeah.
said, your brain
Exactly.
has figured it out. Neurologically, you've calmed the nervous system
Yep.
down so that it's not freaking out.
Yep.
And things are starting to pattern themselves to figure out, oh, okay, here's what we need. I said, next time you get on it, there's going to be a less of a learning curve. But at the
Yep.
beginning of any type of balance, and especially this is an advanced balance piece of equipment, you're going to have that big learning curve for that.
And one thing I always say about balance too is if you are training balance for somebody, you really want to be consistent, especially with your older clients, especially their clients. Like younger clients, not so much. I found I can do some balance work stuff with them, and it sticks. Like the next time they do it, they're much better, and that kind of
Sure.
sticks. A lot of my older clients, it doesn't stick at all
Yep.
unless I really do definitely every week. And oftentimes I've got to give them homework. So they're doing something 3 times a week. Doesn't have to be hard, but they've got to kind of keep that learning process going,
Yep.
and keeping that neurological integration going in terms of training balance, or they just It just takes them forever to kind of get it together. Yeah,
Yeah.
or they don't quite. They're always coming back to kind of the same starting point if it's once a week or once every couple weeks.
Yeah. And when you're talking about trying to get someone to stabilize their knee, especially an older client who needs balance work anyway, it's a good 1-2 punch
Yeah.
because you're going to get both out of the exercise.
Yep.
And
Yep.
you were
Yep.
the first person to
Absolutely.
clue me on this 10 years ago or whatever it was when you said, look, you can improve your balance at any age and it doesn't take much time. So you can do 2 or 3 minutes per session with someone and it's going to start making a change, especially if you can have them be consistent at home as well. But it begins to make a change relatively quickly. And I
Yeah.
found that to be 100% true. And it's an easy thing for me to do with my clients who need knee stability work to say, here's what we're going to do. I want you to stand at the kitchen counter, hold on to the counter lightly, as much as you need, but as little as possible. Stand on one leg, kick the other leg around, or lift one arm up, lift the other arm up, whatever it takes. And I do this with my 30-year-olds, my 40-year-olds, because the leg that has no problem with the knee, they're like, man, this is strong. They go to the other side and they go, yeah, it's
Ah.
not quite as strong. I'm not quite as stable. I said, exactly.
Yep. Yep.
So just something to think about.
Yeah, and then looking, coming back to kind of the knee itself, right? We've done the bottom, we've done the top, and it's the middle of both those systems, the hip and the ankle and the foot.
Yep.
But there's also, just working at the knee and working on. I'm kind of a big fan of balanced quadricep strength and quad and hamstring
Yes.
co-contraction. So I found, and this is true when they do studies as well, that clients can be quad dominant or hamstring dominant, or they can use really both when they do something like a squat.
Yep.
And sometimes I'll just test them. I will just feel their hamstrings. Typically, the hamstrings are the ones that aren't working very well there.
Yeah.
And their hamstrings are just mush, right? Like their quads are really strong and solid, and the hamstrings are just not doing a darn thing. So
Mm-hmm.
then I'll play with where their leg position is. Maybe I'll move them more towards their heels, which tends to get the hamstrings going a little bit more. I may adjust their body position so that when they're going down and up in something like a squat or footwork on the reformer or chair work on the chair, any of those
Yep.
situations, they're getting both the front and the back working together.
Yep.
And that's something I often find is that's a little more subtle, but working on that balance of front and back can make a really big difference for clients as well.
I learned that a long time ago with just thinking about balance because most of the exercises that we do in fitness are going to be the squat, the lunge,
Yeah.
or a variation on that leg press, whatever it is. And you might do one hamstring exercise, or you
Yeah.
might do a stiff-legged hamstring exercise,
Yep.
uh, whether it be stiff-legged deadlift or whatever. But the focus is normally on the quadricep. We are very quad dominant in fitness in general.
And sensation wise, you
Oh,
feel your
yeah.
quadricep. You don't
Way
feel
more.
your hamstring. I mean, for the most,
Absolutely.
unless it's cramping, basically.
Yeah.
If it's not cramping, you're really not aware of what it's doing. Because you bring clients awareness to that and they're like,
Yeah.
hamstring? What? Like, feel
Until
it.
it starts
Oh, what do you
burning.
feel? Until it starts burning. Yeah. Or
Yep.
cramping. It's like
Or
nothing's happening.
cramping. Exactly. So a
Yeah.
lot of clients, they don't realize I push them. And I like to
Yes.
train both ends. I like to train the
Yes.
upper. I
Yep.
like to train the lower. And if
Yep.
they have knee issues, I train the heck out of the lower end.
Yep.
And yes, it's a muscle, it's a two joint muscle. When it contracts, it pulls both joints towards one another. However, you'll feel which one you're utilizing more. So knee bending, the stool scoots that I do in the hallway, sitting on a
Yeah.
little mechanics stool and having them
Yep.
walk up and down
Yep.
the hallway.
Crawl themselves forward by grabbing the ground with their foot,
Oh
right? And
my
keep
gosh,
forward.
does that burn?
Exactly. Exactly.
But they need that. And by changing the foot positioning slightly, not
Yep.
tremendously, but slightly, you can pull a little bit more medial or a little bit more lateral on the hamstring. So if you notice that they're always turned out, you can make sure that they're perfectly straight, focusing on that, and it's going to pull a little bit more of the medial head of the hamstring.
Exactly.
And it's a great way to just get it, and it's cheap. A mechanic stool you can get for like $50.
And you
And
probably have something in your office that rolls anyway, whether it's your office
yeah,
chair or a mechanic stool. Yeah, there's always something that rolls
I will
usually.
say this though, the lower the better.
Yeah, you want it a really good solid 90 or a little lower, right, in terms of
Yeah.
the hip flexion. Yeah, you don't want it
Yep.
higher than that.
No, because the higher it makes it way too easy. I like to drop them low.
Yeah.
So that's why I like
Yep.
them to be as low to the ground as comfortable, depending on
Yep.
their height,
Yep.
but it works like a charm. And again, it focuses that lower end hamstring and really does help with the stability from the backside and help with the balance between the quadricep and the hamstring.
Yep. Yeah. So that's I mean, again, that's another piece. So again, I think hip and ankle are often the most effective thing for me, like,
Yep.
honestly, in terms of just making quick changes and improvements in terms of knee stability and decreasing knee pain.
Yep.
But those next little subtle levels. And again, that's where, like, with a squat or with footwork or a lunge, anything where you're going into those bent knee positions, I find, you can just subtly shift the weight. If I'm shifting my weight forward towards the ball of my foot, towards my knee, my quad will light up like mad. If I really keep myself back, like I'm doing a lunge, but I'm really keeping my back like upright, I'm not leaning into it at all, that will
Yep.
often get a little more of the glute and the hamstring. So it's just
Yep.
like playing with that balance as well, can be super, super helpful. So hip, ankle, knee, all those pieces together to really get the knee stability going, because that'll keep people happy and healthy for a long time. Knee injuries are super, super, super common.
Yep. And something to keep in mind is your cueing with, if you're
Yeah.
working with a client, your cueing is so important. I learned this with wall squats, where they literally just lean against the wall and go into a squat position and hold. Well, most people will want to push their feet out away from them, and that's all quadricep.
Yeah, exactly.
So I will tell them, I want you to push straight down through your heels. Or
Yep.
I want you to feel like you're almost pushing down through your heels and almost pulling it toward the wall a
Yep.
little bit.
And man, the hamstrings just go whoop. It
Light up.
totally, totally changes that connection.
It does. And they can last longer, but not only that, but everything's getting it. It's not so
Yeah.
quad focused.
Yep.
So your
Absolutely.
cueing is
Yep.
vitally important on getting their hamstrings firing to get that balance between the two. So just
Yep.
keep that in mind
Bringing
and
their
changing
awareness
it.
into it. Yes.
I will change it. Sometimes I'll say, now I want you to push through the toes a little bit. They'll go, oh, that feels different. And then
Hmm.
2 or 3 repetitions, now push through the heels. How does that feel? How does that change the way it feels? And they say, oh, okay, I'm feeling more of this. Make them become a little more proprioceptive within their own body, so they're not just going through the motions,
Yeah.
So it wakes their brain up too, as to, oh, I feel it more this way, because it also gives them ownership. If you can give them ownership the next time they do the exercise, and I've had clients tell me this, heels right, push through heels right.
Yeah.
I'm
Yeah.
like,
Yeah.
yeah, you
That's what we're
got it.
looking at. You got it.
So yeah.
Well, this
Well,
was a really very practical session. I've got a
yeah.
lot of suggestions for you you guys out there. A lot of different ways to work with lateral hip, to work with the ankle and the foot, and even then to work with a balance around the knee. So lots of things to play with in terms of seeing what works for your client, seeing what
Mhm.
really brings them the most relief if there's a knee issue going on. Yeah, there's a lot. There's a lot in there. A lot of toys to play with.
And a good place for people to start when a client comes to you.
Yeah.
Nora and I have, up 10 years of experience working with the knee that we can pretty much take a look at and know roughly where we want to head with someone who might have some knee issues or knee pain. Whereas if you don't, these can give you a lot of practical
Yeah.
tidbits here and there of where you may want to start to see if you can help with that client, you know, and put them on the right path. So, like I say, practical, or if you yourself have knee pain and haven't been thinking about, changing things up in your training, except for what's number one, oh, let's not work our lower body anymore. No, no, let's just change how we're doing things. So, this gives you a lot of practical information that hopefully will help you out and hopefully give you greater knee stability and reduce some of that discomfort.
Exactly, because knee stability, and don't just think of this as don't in fact don't think of this as rehab.
No,
Think of this as what's necessary for most people's knees to be happy for life, right?
100%.
Because knee stability, I mean, knee injuries are so, 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 so common for every age, every group, every activity level. It is one of the most commonly injured areas in the body, from a
Yep.
musculoskeletal perspective. And because of that, like, this is all preventive, right? All this work
Mhm.
is going to hopefully keep that knee happier longer, which is what we're aiming for.
Absolutely. Absolutely. So think of it as preventative maintenance.
Yeah,
Something
exactly.
throw in there, a little bit with each session. And believe it or not, it's going to make you're going to pay off in dividends down the road.
Exactly. Absolutely.
Cool. Well, thank you guys for joining us.
Yeah.
Moving Conversations. We had a wonderful, I mean, I did not know where this was going to go today, but I knew we'd have fun with it. And I think we did cover a lot of good practical,
Yeah, absolutely.
things you can take and use immediately. And I think you and I are
Absolutely.
both big
That's the
in that
deal.
just in general.
That's our
So
goal.
yeah, practice and play. Keep an eye out for, some of our exercises and some of our, Anatom minis on Instagram. And you can always reach us at movingcombos@gmail.com. Instagram, we're at Moving Combos. You can also, hit us up on Facebook. And for Nora St. John, I'm Brian Ritchie. We'll see y'all next week.
Bye, guys.